Hello, everyone. Mike Mosquito here with the Buzz Podcast, along with my co-host, Maureen.
Nylene.
On location this week at the HIMSS Texas Regionals Conference in Dallas, Texas. We're here at the wonderful, wonderful resort of the Gaylord with our friend, Chani Cordero. Chani, glad to have you with us.
Thank you. Excited to be here.
You having a good week?
I am.
What have you seen fun around us this week?
I mean, like the hotel, the venue is amazing. Let me start with that. How large these things are. I swear I walked around my 15 times.
It's large. It's
Call it exercise now.
Yeah, you will get your steps in. We were just in a Gaylord 2 weeks ago in Nashville, right?
All
yeah,
together.
we were all together 2 weeks ago.
Gaylord World Tour.
Yeah, it's not a bad
You should
show.
get a punch card.
All right.
Yeah.
Yeah, that was a great experience, but I'm glad to be here with you. Maureen and I love your interaction and what you're doing in the industry right now because you're known for your leadership, right? You're known for that. You made your stamp based on your background for showcasing leadership qualities, how to govern leadership, how to guide young people through leadership and executives. Tell us a little bit more about what you're doing in that area.
And so yesterday, I sat on the panel and we just, we talked about leadership in general. And what I shared with the audience is about 10 years ago, I really codified my leadership philosophy. And with that, it starts with being visible, right? So I say visibility. And what visibility that means is that when you need to be seen within your organization, you need to be seen with your employees, you need to be seen with your staff, because that's how you really get to hear what's going on. You have to take that time and make that time to be visible. And with that, you're able to hear problems and challenges and kudos and glad.
All right.
Yeah, it's not always
Constructive criticism.
exactly right. But you're able to hear it. And then once you're here, you're able to address it. And when you address it, then that goes to my second phase of my philosophy, which is visibility leads to credibility. Because now, people believe you. They believe in, that you care and that you listen to their problems and their challenges and you address it. And now that you're credible, that actually leads to trust. Right. And so visibility, credibility, and trust. And with trust, people know that, it's the kindergarten saying, you're going to do what you say you're going to do. And then it's so simple. And it's something like, why doesn't everybody do it? Because it's so simple.
Right.
You build that you're trustworthy. And then once you build trust and establish that, now you got relationships. And with relationships, that's how you get anything done.
Right.
Which leads to results. Mm-hmm. So
And that's what you're trying to get to. And I have to add, though, that I do think part of where you are uber successful is you just have this flamboyantly beautiful, warm personality. And every time I'm in your space, I just feel so happy. So I do think that as you're talking about those leadership qualities, it's also approachability that you provide. And maybe that's what you mean by being visible.
Right. Yeah. I mean, being visible and being present, but, absolutely being approachable. Some people, what they call, the resting, whatever.
Yes.
People have that. And if you're one of those folks, that's okay.
Yeah.
That's who you are. But then also, make an environment that people are able to talk to you and you're not going to stop at them or.
Yeah.
I think as we talk about, these qualities and exuding what you want to see in others and you want to grow in others, I think we talk about how do we approach that from a very complex problem in healthcare being this gap in being able to provide care in this future and being able to lead people through these hard times, right? Being able to put together the right team that can take on these challenges, find the opportunities to grow, to evaluate themselves internally and as an organization. How do you take on that approach across? Because I know your leadership philosophy definitely targets you, and you took the group 2 weeks ago through an exercise. Give us a little bit more on that, your approach, that house-wide approach.
Yeah, no, so healthcare is complicated, right?
Very much.
We all know that. And it's complex, and there's a lot of people that's involved with it, to include the patient. And so when we're building something, you have to build those relationships. And in the end, that's what it always comes to, relationships. with that, I have so many teams, and I really like General McChrystal has a book called Team of Teams.
Hmm.
And the point of the story is essentially is you build teams, right? And then you build a team of teams to get to your state. And so, how do I do that with large problems? Is that
Right.
you build teams that focus on different areas, but at the end, you bring them together and you have a team of teams that actually get you to your result.
Very nicely done. And that team of teams helps organization one replicate in more than one way, one process wise, right? An understanding of the organization for new people that are coming in, interns that you may want to groom, right? Or new organizations that want to spin up maybe a new strike force for governance, right? And how do you do that if they know and understand that philosophy, right?
Right, right. That we're all part of the team. I think, sometimes in some organizations, we're competing against each other. And there's no competition, right? I mean, really, we're competing against sickness. That's
Right.
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 And so, even being on the Hammond side and I'm an IT gal, through, I even remind my own clinicians is that I get my care here. I get my parents get their care here. My children get their care here. So I'm invested. Like I'm invested in making sure that you're successful. Sometimes I have to do it in a way that you may not understand because I have to worry about the cyber
Right.
elements of it. I had to, I have a finite amount of resources
Mhm.
that I have to spread. And so I want to help you. I want to build you in this application. I want to bring in this software or this medical equipment, but I have other things that I have to worry about.
Right. We all can't be A students though either. And so recognizing what somebody's strengths are, because I do think that as I was starting my leadership journey, I kept focusing on the things I wasn't doing well. And I kept trying to fix those.
Mhm.
What I probably should have been doing is just recognize that maybe that's not my skill set. Let's work on the things I'm doing well and make those great. So even just understanding what somebody's strengths and opportunities are, not weaknesses, because we all have opportunities. That's for a leader, really what I think changes the playing field.
No, I like that. And I agree with you. I think a lot of times we're always so much focusing on what we don't do well that we spend a lot of effort and time instead of just focusing on what I do really well.
Right.
Not make excuses and
Right.
it'll be terrible at the things that I'm not, but at least, recognize it says that all right, I have met my match.
Right.
And that's okay. Yeah, I met the match. It's kind of like me and driving. There's not a curb in Texas I haven't hit.
But as we talk about, those four tires and having a bigger budget, how do we address this in healthcare with needing a bigger budget to provide more and better care for better outcomes when there's just not budget there?
Right.
And that's where, where those efficiencies come in, right? I mean, IT is a cost center. And so typically we don't bring the organizations any money. The value that we bring is to enable the care team. And so what are we going to ensure that money that's spent on IT is money worth spending, right? And it just goes back to every CIO in this room, always says like we're problem where we solving, right? And making sure we're not taking our limited dollars and money and the resources and throwing it to a process issue or something like that.
Very well said.
My students always laugh because I'll tell them, what happens when you throw money at a bad process? You just have a bad process. And so, as IT leaders, I think we have evolved over years where before we were just kind of like a commodity where you just kind of, do it because, someone said like they want it. And now we're marketers.
Right.
We're healthcare administrators. We take the same certifications and we'll do the same conferences as any of the CEOs, right?
Right.
Sorry, business partners and leaders. And what we bring is the IT component, but in the end, we're leaders as well, and we listen to challenges and problems that our clinicians and our teammates are having, and we look for solutions for them. Sometimes with IT, sometimes without.
Yeah. Yeah. So let's talk a little bit about your multi-hyphenate already. So CIO, I hear you're going to have some fun transition and upcoming. You also are teaching.
Yes.
You are a published author of a planner that people can go out and purchase. So there's a lot that you are always constantly doing, but what's next for you?
So I am retiring from my current from the armed forces.
Yeah.
I've been there for 25 years.
Wow. Congratulations and thank you.
I appreciate that. Thank you. I am so excited and so terrified.
Because that uniform does look good on you.
I mean, green is my color.
It is your color, but I don't know if you want to sign up for another 20.
This is also her color.
You're killing it.
You are.
I love having fun at these events. So I'm retiring this year. I mean, hopefully, my goal is to stay in the healthcare IT field. So I also would like to, continue to, move hospitals.
Very nice.
And so that's the goal.
Excellent.
So your job is you now want to take all of this education, training, preparation from a military background and definitely layer that across an institution, a healthcare IT job that can help other hospitals, right? You're in a segment of the hospital business that's kind of isolated, right? For the most part, because you have systems that you are required to have. But now you get to take all of that training and education and say, look what I can do from a leadership standpoint. Here's what I spin up. And like no one else has, because I'm a military leader, not a general CIO that's just IT, CISO. You've got a different level that you can go deeper on. And I think that's important because some come into these roles and they are technologists, not leaders. There's a big difference between a CIO that can lead, drive, understand, and repeat.
Yeah.
Right? Versus just put some technology in and wash their hands and move to next.
I think you just crafted a beautiful resume for Chani. So
I know.
for all of our listeners out there, this is the promo reel for sure. Yeah.
The Buzz.
It's so true.
The Buzz resume service.
Yeah. It is neat that you do get to translate all of those skills from one environment to the next in a way that's totally dynamic and different than what you were doing before.
Yeah. I really appreciate what I have learned in my career. Public sector is different. And I think, when I come to events like this and I tell our story, I like to tell our story because there's, we had a lot of advancements, not just part, the DoD health system, but I'm talking about the VA as well. And, even other services like Indian Affairs that also has some, great ways in their healthcare delivery. And so what I, cannot wait is to be able to bring some of the structure and governance that we do very well and bring that to organizations that are not quite there yet.
Right.
Beautiful.
Well, Chani, thank you so much for joining us on the Buzz Podcast today. It's always a pleasure to have you.
Always.
Yeah, no, thank you for allowing me to be here and tell my story.
Well, we wish you all the best on this new adventure you're going on.
So January 1st is the official day, but you can call me now.
Look, 1-800 Chani Cordero. Or you can reach us at thebuzzpodcast.net and we'll make sure we connect you with Chani, but you can find her on LinkedIn as well. And she'll be listed on this podcast. So please reach out to her if you'd like to hear more about Chani.
Definitely.
We definitely endorse her. Buzz Podcast is here for you to help you understand these stories like Chani's and guide you through this journey in healthcare. Maureen and I thank you for joining us, and we look forward to seeing you soon. And find us on thebuzzpodcast.net. Please make sure you like and subscribe. And we'd like to thank our podcast media sponsor and our wonderful host for today, Panda Health. We thank you all and look forward to seeing you soon. Keep buzzing.